Good morning, and thank you for joining us today. We are gathered on the territory of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection with this land. I am Dr. Luanne Metz, Alberta NDP Critic for Health, and I am joined here today by my colleague, Marie Renaud, Alberta NDP Critic for Community and Social Services. In March, Albertans were horrified to hear the story of a 62-year-old man who was dropped off at a motel for continued care after being discharged from the hospital. Blair Caniff was told he was going to a facility for continuing care after being discharged as a patient at the Royal Alexandra Hospital for 6 months. Mr. Caniff uses a wheelchair, and while he was expecting to be moved to an assisted living facility, he was dropped off at a travel lodge in Leduc. The motel room where Mr. Caniff was dropped off was too narrow to navigate in his wheelchair. He could not access the bathroom, his hygiene was not managed, and he was being fed fast food. Unfortunately, Mr. Caniff was not the only Albertan who was left in a motel instead of being taken to a proper continuing care facility. Many other Albertans had their loved ones brought to a motel for care. One of the families gave us a copy of a letter that was presented to patients when they were being discharged from the hospital. The letter from Contentment Social Services does not indicate the location for the patient is a motel, totally lacking in the supports required for someone needing ongoing care. It describes it as a specialized housing program. Minister LaGrange and Minister Nixon were questioned heavily about how Contentment Social Services was vetted to be one of the approved Alberta Health Service providers. Adriana LaGrange, and the Minister of Community and Social Services, Jason Nixon, knew that Contentment Social Services had a connection to AHS. And more importantly, they knew this provider was a problem. In an email between these ministries, the Ministry of Health contacted the Ministry of Community and Social Services to pass along concerns from an Albertan receiving AISH, who expressed concerns about a Contentment Social Services group home. The Ministry of Community and Social Services responded, indicating that they told the individual they could seek out additional resources through 211 or 811. But this email also indicated that Contentment Social Services had a connection to Alberta Health Services. In short, the Minister of Community and Social Services said, "This isn't my problem." What's even more alarming is that this was brought to the attention of Minister Nixon and Minister LaGrange in January of this year, 2 full months before the news of Mr. Caniff being placed in a motel for care was reported to Albertans. I'd now like to turn things over to Marie.
Thank you, Luanne. It's extremely alarming that Minister Nixon and Minister LaGrange knew of issues with Contentment Social Services 2 full months before they stood in front of reporters and claimed they were unaware of how a patient could have been dropped in a motel to receive care that was not in place. In the email, the Ministry of Community and Social Services outlines that the complaints from the individual include that their basic needs were not being met by Contentment Social Services, that the individual expressed a desire to explore alternative service providers, and that individual was told they could seek assistance for their concerns through 211 or 811. The individual's concerns were passed from the Health Ministry to the Community and Social Service Ministry, and then back to the Health Ministry. But the email also indicated that Contentment Social Services has an AHS connection, so it's a problem for health. What happened to this individual's complaints from January 11th, 2024? We don't know. In fact, there might be many more complaints of this nature, but the public will never know about it, as public reporting under the Protection for Persons in Care Act stopped for no reason in 2019 when the UCP formed government. But it seems as though the health minister did no further action and no further follow-up on the inadequate care provided by Contentment Social Services. Because as we know, 2 months later, the same provider was bringing patients to a motel where they could not access the bathroom and they were being fed fast food. What happened to Mr. Kniff and the dozen other individuals who were receiving care in a travel lodge did not need to happen. Jason Nixon and Adriana LaGrange knew that there were issues with Contentment Social Services at least 2 months prior, and they did nothing. This inaction from the people responsible for Albertans' care is utterly unacceptable. Now, this very same Minister of Health wants Albertans to trust her to completely reorganize the structure of our healthcare system. If Danielle Smith's ministers cannot handle the vetting of one service provider in our health system or take accountability for their work, they should not be responsible for significant undertaking of an entire system reorg, especially while so many Albertans are struggling to access the most basic care that they need. Danielle Smith must pull Bill 22, as it's designed to completely gut Albertans' healthcare system. If Adriana LaGrange moves forward with the system reorg, the province will be left with a decimated public health system, and it will cause more harm to Albertans. Thank you, and I'm happy to take any questions that you may have.
Thank you. Just a reminder, if you're on Zoom, to raise hand function to get in the queue, and if you're on the phone, it's *9. Please state your name and outlet and who you'd like to direct your question to. We'll start with questions in the room. No, we'll move to the phone then.
Thank you. It's Catherine Gurkowski, Alberta Today. I didn't catch, what was the connection with Alberta Health Services to this provider?
Well, obviously, based on the FOIP, there is a tie, they're an approved vendor. So no organization or company will be paid by Alberta Health Services without being an approved vendor. So clearly, there had been some particular service provider, I believe, would have fallen under the umbrella of PPCA, which is Protection for Persons in Care, and then could have been reported and investigated. But sadly, this particular department under health has not publicly reported since 2019.
Do you have a follow-up, Catherine?
No, that's okay, thanks.
Okay, we'll go to our next caller. Shaylin, your line should be open. Shaylin, you're muted, I think.
Hi, can you hear me now?
We hear you, thank you.
Sorry about that, Shaylin. It's supposed to be CTV News. Thank you for taking my question. I'm just wondering what action you'd like to see from the province on this. I know you mentioned the pulling of Bill 22. I know 2 months ago the province launched the 4 investigations. I guess what action do you believe is needed from the province now?
Well, I think that both ministries need to be very clear with Albertans about the process for becoming an approved vendor. So both the Health Ministry and the Social Service Ministry have very clear rules in place that service providers, whether they're private companies or nonprofits, need to go through to be approved vendors. So we need them to transparently look at these and report what's going on. So clearly we know that people are falling through loopholes, which are sort of like the Grand Canyon, and so there really needs to be some work. The other piece I think that that needs to happen is, why is it that the Ministry of Health has not been publicly reporting on the body that investigates abuse allegations for homes, for service homes, like the one described that Contentment Social Services was providing? So a couple things. Ministries need to be very clear about who's on the approved vendor list instead of pointing fingers about whose problem it is. And the other piece is they need to transparently report to Albertans which allegations of abuse are being reported, investigated, and what are the findings.
Do you have a follow-up, Shay?
Yeah, just wondering if you have any knowledge as to what the situation is with Contentment Social Services currently. Are they still operating? I mean, we've tried to contact them. I tried to reach out to them as early as this morning, and the number's no longer listed in service. We've heard from some people who are still awaiting repayment from them after their family members have been removed from their care months ago. Do you have any knowledge as to where the company stands?
I do not have knowledge about specifically where the company stands, but my guess, based on the quick reaction from both ministers looking to cover their behinds, is that they are no longer receiving contracts or no longer have contracts with government. So I imagine what was difficult to find before in terms of the relationship with this provider and government will be even more difficult now. But I think if this government wanted to do an about-face and do things differently, they would transparently report to Albertans what happened and how will they prevent this from ever happening again.
Great, thank you. We'll do one more quick pass for questions. Just a reminder, if you're on Zoom, it's raise hand. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.